are here for the October month of 2024. So as you know that October is the pink awareness month. That's the awareness month for breast cancer, the most common cancers all over the world in females and also in India now. So as we are heading towards new generations, we are seeing a huge rise in breast cancer patients. So it may be attributed to the westernization of civilization, and along with that lesser amounts of people having breastfeeding, doing breastfeeding. And also one thing for sure is like breastfeeding can reduce the risk of breast cancer by 10 times. So we always encourage breastfeeding for women with children, and it can actually reduce the risk. So nowadays breast cancers have a lot of genetic basis behind it. So many patients do have some genetic mutations. So as it has been already discussed, probably that USG and mammography are the screening tests which are regularly done between the age of 40 and 65 every 3 yearly to detect breast cancers in early stages. So the highlight of my talk will be on the systemic management of breast cancers. So as you know that breast cancer nowadays it's not like it was 10 to 20 years back. So previously we used to treat all breast cancers in the same way, but as days progressed, our science from the data from science, we understood that every individual is different, and so is his or her breast cancers. So even males do have breast cancers, so that's why I use the term his. So male breast cancers are also seen. And it occurs in 1% of the people, and it can be generally it has a hormone receptor positive cancer which have a good prognosis, and it can be cured. So again, like breast cancers broadly can be divided into hormone receptor positive breast cancers, HER2 positive breast cancers, and triple negative breast cancers. So how do we categorize this? These are done from biopsy. Whenever you suspect a breast cancer, don't operate upfront. So get a biopsy done, a true cut biopsy, through which we can do an immunohistochemistry test and then determine on the molecular subtype of the breast cancer. Depending on these molecular subtypes, if the tumor is either more than 2 cm or if any lymph node is positive, which can be determined better in a PET CT staging or a CT scan staging. So then we actually, if it's a triple negative breast cancer or a HER2 positive breast cancer, we would advocate chemotherapy or immunotherapy or targeted therapies upfront. So I will one by one go into the different types of breast cancer and just highlight a little bit on the importance of the therapies. So first of all, about the hormone receptor positive breast cancers. So these are the best type of tumors where hormonal therapy plays an important role. We generally say estrogen receptor, progesterone receptors. So these hormonal receptor positive breast cancers do have a very good prognosis, in the sense that the chances of the disease relapse in the first 5 years is lesser than their HER2 positive and triple negative breast cancer counterparts. So how do we treat these? So in early stages, if the patient is detected in very early stage, then just a mere surgery, breast conservation surgery with some sentinel lymph node biopsies might be just enough to treat these kind of cancers, and you may not require chemotherapy at all. So then what would we do? We would probably radiate. We will give some radiation doses, generally breast conservation surgery whenever it's done. If it's in not in the postmenopausal women, and if it doesn't have any, if it has any of the risk factors, then we generally radiate the patient. So 19 to 20 fractions of radiations are given generally. After the radiation, we start on with the hormonal therapy. So hormonal therapy may differ from age to age, like premenopausal and postmenopausal have different things to be given. In premenopausal women, we give something called tamoxifen, and in postmenopausal women, we give something called aromatase inhibitors. So along with in the postmenopausal women, in women who do have a higher risk, we always suggest adding that ovarian suppression along with it. So I have discussed previously in my videos about ovarian suppression. Ovarian suppression is something which has been shown to benefit these kind of premenopausal women with breast cancers, hormone receptor positive breast cancers, who have a risk of disease relapse ovarian suppression in the form of surgery, which is done by bilateral oophorectomy, or in the form of medically, which is given in the form of injections, that GnRH analog injections. So these things can give ovarian suppression, which actually results in a better disease-free survival in breast cancer patients and lower relapse rates. And along with it, nowadays in hormone receptor positive patients with higher risk of disease recurrence also receive something called abemaciclib. So these are again CDK4/6 inhibitors. So these are CDK4/6 inhibitors like abemaciclib, and recently some data is also coming up with ribociclib. So these are given in some high risk individuals with premenopausal ladies with breast cancer who are hormone receptor positive, and with lymph node positive diseases and little advanced tumors, little higher grade tumors. So these tumors have shown to have benefit for a particular use of this abemaciclib and ribociclib. So so this is what about the mainly about the hormone receptor positive breast cancer, and these are the various hormonal therapies which we talk about. And even in metastatic breast cancers, in hormone receptor positive disease, we do have a very good prognosis. So generally we treat it upfront with CDK4/6 inhibitors along with some the hormonal therapy backbone like aromatase inhibitors or tamoxifen, and then we go for the next line of treatment. If it progresses and all, then we might go for abemaciclib, or we may go for if the abemaciclib has already been used, we can go for PIK3CA mutation testing and then see if that there is any need for alpelisib or something like that. So there are various options nowadays. And for the HER2 positive breast cancers, so HER2 positive is we generally give some targeted therapies called pertuzumab, trastuzumab, and these kind of injections which are quite costly. Recently, Indian brands have come up with some form of pertuzumab and are available now. So that means congratulations to the patients who can afford it now. So these are the drugs which are used in HER2 positive breast cancers. So the basic point is, whenever it's a HER2 positive or a triple negative breast cancer, if it's more than 2 cm or a lymph node positive disease, the patients generally go for neoadjuvant treatment, which is some form of treatment is given before the surgery. So either with chemotherapy, and it may have some targeted therapy backbone like pertuzumab, trastuzumab, like these. So these are anti-HER2 therapies. And similarly, in triple negative breast cancers, we add on pembrolizumab nowadays, which is an immunotherapy injection, so with the chemotherapy to downstage the disease, and it also takes care of the micrometastasis or the spread of the disease systematically. So these are the various options which we know now, and these are the various areas where how the breast cancer differs nowadays. So there is now a bigger data which has come up with newer drugs like trastuzumab deruxtecan, and then again sacituzumab govitecan. So these are a few difficult pronunciations and difficult drugs to remember, but yeah, these are showing promising results in not only triple negative variant and HER2 positive variant, but also with HER2 low tumors and in hormone receptor positive breast cancers in metastatic setting. These drugs are now coming into the play. So the future is bright, and it looks brighter because every day new research and new things are coming up in breast cancers. So I just wish you a very happy and healthy life, and I just request you all to undergo your regular screenings, which is 3 yearly ultrasound and mammography after the age of 40 till 65. And whenever you have any doubt, just always go for an oncological opinion, and always get your treatment done in a proper center with all the facilities under one roof, and with the tumor board meetings, because it's a group of doctors who decide on the best treatment possible, not an individual doctor. So breast cancers are curable, so don't miss it. So I wish you a very happy and healthy life, a very cancer-free life. So that's my wish. Thank you so much.